Hello guys, hello doctors, hello friends, hello family. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, for those who don't know, I'm a second year medical intern. I graduated from Pretoria University and I'm currently working in Nelson Mandela Academic Hospital, which is in the Eastern Cape. So guys, I just want to remind you again of why I created or I started this channel. I'm very passionate about teaching. That's the first thing. I love teaching and I've always loved sharing information. So one of the things that I've realized when I was in Turks during our clinical years and also when I came this side, I realized that clinical medicine is difficult, or it can be very difficult, and it can be it can be so overwhelming for many of us. And one of the reasons is that clinical medicine is like different from basic sciences. As much as you still use your basic sciences in clinical medicine, but it's different, and I'm going to explain why or how. Remember, in in basic sciences, during the first 3 years of 4 years, depending where you are studying, or 3.5 years, the basic sciences, as a student, you can get distinctions without attending, without going to class at all, and still get distinctions. But clinical medicine is different. In order for you to do well in clinical medicine, you need to attend. You need to be in the hospital. You need to clerk patients. You need to get involved. You need to present. You need to see what doctors do, how they take history, how they examine the patient, how they organize their thinking when it comes to patient management, depending on what case they are seeing, what drugs do they use, what tests can be done on the bedside, what tests can, so that kind of a thing. So that's what clinical medicine is all about, even how they take history. I mean, a patient does not really care if how good you know your basic sciences. What they care about, did you talk to me well? Like, did you take history well from me? Did you listen to me? Did you examine me? Did you actually come in and see what my complaint, entertain my complaint? Did you actually, did you touch, did you examine me? Did you touch my swollen foot? And from there, they want to get better. They want to get better. So you can be a very good doctor, or you can be, I mean, your basic sciences can be like up to scratch, like we are very good there, and still lack clinical skills, and still lack and not have good clinical judgment, clinical acumen, just because you never attended, you bunked rotations, you didn't go to the hospital. And that's when you are actually being taught how to be a doctor. Clinical medicine is teaching you how to be a doctor. I'm not saying you need not to know basic sciences as a doctor. That's not what I'm saying. We all know that you need that. But clinical medicine is teaching you now, how do you think like a doctor? How do you do things like a doctor now? When you've got a patient like this, how do you organize your thinking around this complaint, around this pathology and things like that? So I have seen that students that love to study on their own, they sit in the library and all of that, they don't always do well when it comes to clinical medicine, because sitting in the library will not teach you clinical medicine. I mean, studying the whole night will not make you a better doctor, will not make you a better clinician. It doesn't. You need to be there. You need to get involved. You need to see what doctors do. You need to watch and learn, things like that. So that's what you need to develop your clinical acumen as a doctor, your clinical reasoning, your clinical judgment. So like I said, there are so many students that would be like, I need to go and study. I'm not going to come to hospital tomorrow. And when you do that a lot, it's going to catch up with you when you need to be an intern. Like I said, this channel is mainly for students. My main target audience is students, medical students, clinical associate students. And if you're a doctor, you have subscribed to my channel, thank you so much. I know that you don't really need to hear what I have to say because, yeah, you're a doctor. But for students, I'm talking to you. So for those who are doctors who have subscribed, thank you so much for supporting. Thank you so much for supporting. So that's what it's all about, guys. And I know that as students, we always think that it's better to go and sit and study and not come to the hospital. You might get your okay-ish marks, but come internship, you're gonna struggle. You're gonna struggle with history taking. You're gonna struggle with clinical reasoning, differential diagnosis, doing relevant investigations, and that type of thing. You are gonna struggle. And someone who has not attended, who doesn't go to the hospital, you can just see them, you can just hear them. It's like even with drugs. If they ask you, what drugs would you give for this hypertensive patient, then you start mentioning drugs that are not even in South Africa, or drugs that are not in in private, they're not in the public sector, then they know good to know. Even the investigations, even your differential diagnosis, once you start to mention for a chest pain, you start mentioning things that are like, then they will know that you have not been attending. So guys, what the channel aims to do, that's why it's called Clinical Medicine. What I do in the channel, I discuss clinical medicine topics. I don't really go into detail in terms of your basic sciences. It's just clinical medicine. Sometimes I even take cases from the hospital, an interesting case, and then I discuss that. In my channel, there's a feature called A Patient That I Saw. So under that, if you go to the playlist, it's a patient that I have seen, interesting patients, and yeah. So this channel, what I want is try to help students to better their clinical reasoning and their, like, your thinking, how to organize your thinking. Like, that's why I like most of my topics are like approach to a chest pain. How do you approach a chest pain patient? The practical side of things. How do you approach a chest pain patient? How do you approach a patient with a PV bleeding? Remember, when the patient comes in, will come in with a complaint, but as a doctor, it's your duty to get to a diagnosis. So how do you move from just PV bleeding to an ectopic? How do you move from PV bleeding to placenta abruptio? Just PV bleeding. For you to get there, there are things that you're going to have to go through in terms of the history, examination, investigations to get there. So how do you do that? How do you make a diagnosis from just an FBC, interpreting an FBC and come up with differential diagnosis, interpreting an LFT and come up with a differential diagnosis? If you've got an LFT, how do you say this is medical jaundice, this is surgical jaundice? In cases where you've got obstructive jaundice, what will kill your patient? What will kill your patient? If your patient's got obstructive jaundice, what is the most likely thing that will kill your patient? Acute cholangitis. So that's your clinical reasoning. You can't diagnose obstructive jaundice and not think about acute cholangitis. But so that comes with seeing patients and see how does a toxic patient look like. How does a patient with, because you are gonna get an obstructive jaundice patient who's not sick, they just have obstructive jaundice, and you're gonna get these ones that are like, it's like they're gonna die now. So those are your septic patients, probably from acute cholangitis. So how do you organize your thinking around that? So things like that. Remember, you can know, let's say heart failure. You can know heart failure in and out, but the minute they put a heart failure patient in front of you, you can't move. You can't even take a history, a relevant history. You know the history that we are taught in medical school. I mean, when we usually, when you just start with your clinical years, they give you that template of how to take history, which I find it so. The thing is with that template, you ask everything from the patient, very irrelevant things at times, and the things that that's why that history, you're gonna take hours doing that history, and still not come up with a diagnosis. It's not a functional history taking. I mean, And like I say in my channel, that when you take history, you want information that will help you to get to a diagnosis. You want information that will help you to rule out some causes or some diagnosis. Because as you take history, you are thinking, could it be this? Could it be this? Could it be? That's why in your history there is what is called important negatives, because you are ruling some other things out and all of that. But that you cannot learn it from a textbook. I mean, you cannot be sitting in the library and think that you're gonna. Yes, you might get your occasion marks, like I said, but when it comes to being an intern, being a doctor, you are gonna struggle. So, guys, I try to make the channel as practical as possible. That's why I even discuss patients, and I hope that you guys are gonna share my channel to all medical students that you know out there. I think it's a very good channel. I'm getting a lot of feedback. I mean, it's only 4 months. My channel is only 4 months old, and I get a lot of feedback, positive feedback from people, students. So I'm hoping to get to more people, get to more students. And guys, you'd help me so much if you would do that and spread the word out there. And yeah, I hope you're gonna enjoy clinical medicine with Dr. T. Thank you so much.